My name is Brandy. I will be performing respiratory skills for you today. First off, we're going to administer a nebulizer treatment. I've already checked my orders and gathered all my supplies. Now I'm going to verify my patient. Hello, Mr. Smith. Could you tell me your name and date of birth, please? All right, thank you. Check the wristband. All right, I have your nebulizer treatment, and I'm going to help you with that today. Before you would administer this nebulizer, you'd want to listen to your patient's lungs and check your patient's pulse. You need to get a baseline reading on your pulse, because after the treatment is over, you want to reassess the pulse, and if it has raised it more than 20 above what your baseline number was, you need to notify the physician. So, normally you would listen underneath the gown to osculate the lungs, but I'm going to do it over the gown. Okay. Alright, Mr. Smith, I have your medication now. Medication comes in a vial like this. Sometimes you'll need to mix it, but it also comes pre-mixed with saline. Alright, Mr. Smith, I'm going to need you to hold this into your mouth until it quits smoking. This could take anywhere from 10 to 15 minutes. If your patient is unable to perform this task by themselves, then you stay in the room and help them, but if they can do it, you can leave the room and come back and check on them. Alright, treatment is over. Turn off the machine. Reassess the pulse. It is not raised over 20, so I do not need to notify the physician. The patient appears to be breathing well. Pulse is great, so now I would make sure the bed is in the lowest position, call light and reach, all personal items within reach of the patient, and exit the room. Okay, now I'm going to administer supplemental oxygen. I've already identified my patient, verified my orders, and gathered my supplies. And this is oxygen tubing. There's usually a spigot on the wall here, and you can dial the oxygen up or down and turn it on by this valve. You want to look at your orders that the doctor has prescribed and turn the oxygen up to the liters prescribed. For this patient, it's been prescribed 2 liters, so turn it to 2 liters, hook up my tubing, and this is a nasal cannula, and it has a little deal for your nares, and you want to make sure that these are curved, and you want to make sure they're pointing up into the nose, not like this, down. And then they hoop around the ears. And make sure it fits snugly, but not as too tight. And you can loosen it or tighten it with this right here. And after you have placed your patient on this oxygen, in 30 minutes you need to come back and reassess the SpO2 reading, pulse, and make sure everything's good and your patient's not hyperventilated. So, and you would want to make sure the bed is at the lowest position before you leave the room, call light in place, everything within range. And now we're going to perform a throat culture. For this, the supplies you'll need is a pair of gloves and one of these throat culture swabs. So, and I have checked my orders and identify the patient, introduce myself, hand washing, all that. My gloves. And this is your throat culture swab, and it will have a label on it. If not, you may already have a label printed in the patient's chart. Just pull one of those off and place it on here, and then you want to initial and time that label. When you open this, you want to make sure not to touch the end of the swab to anything. You have the patient open their mouth and say ah. Mr. Smith, could you please open your mouth and say ah? When inserting the swab, you want to make sure not to touch the lips, the cheeks, or the tongue. And you will swab the back of the throat and the tonsil area, concentrating on any yucky or reddened areas. You'll swab them. And when exiting the mouth, you want to make sure not to touch anything as well. Insert the swab back into the container. Make sure the lid's on there tight. And at the end of the swab, there'll be a little bill that you pop, and your swab is ready. You just need the initial time and date and send to the lab. Now we're going to teach the patient how to use the symptom spirometer. And I've checked my orders, verified my patient, all that good jazz. Mr. Smith, this is an incentive spirometer. I'm going to be assisting you in using it and teaching you how to do it so you can do it on your own. If your patient is recovering from surgery, abdominal or chest surgery, you want to offer them a pillow to splint their incisions to make this a little more comfortable. If they have any pain medication, you can administer that prior to this exercise. This is to help open your patient's lungs and get things moving after surgery or if they've been sitting for a long time. Mr. Smith, this part is going to go in your mouth, and I'm going to need you to breathe in through your nose and out through your mouth. And as you're breathing out through your mouth, you're going to close your lips around this and breathe into the tube. And you want to breathe out as long as you can. All right, here we go. Good job, Mr. Smith. Let's take a break. And we're going to do this a couple of times to make sure that Mr. Smith understands how to do it and have him return the demonstration to you. And you will leave this on the patient's bedside table within reach and instruct them to perform this exercise at least 10 times an hour while awake. So, on the bedside table, patient can reach it. Bed in the lowest position before leaving the room. Call light within reach. Bedside table back by the bed. All personal items. Mr. Smith is good. You may exit the room now. Now we're going to do a sputum specimen culture. And you will need a sterile specimen cup for this, some gloves, and I have checked my orders, performed hand hygiene, gathered my supplies, identified the patient, explained the procedure to the patient. So now I'm going to remove the lid off the sputum specimen cup. Make sure not to touch anywhere inside the cup, because inside the cup is sterile. Alright, Mr. Smith, I'm going to need you to take a deep breath in, and as you're breathing out, I need you to cough. And I need you to do this until you get some sputum, and then spit this sputum into the cup. Thank you. And you'll repeat this until you get 30 mils of sputum in the cup. Replace the lid. You need to place the label with the patient's identifiers, time and date, and your initials. And then place it into another bag to take to the lab. After performing this, you want to make sure your patient's good, still breathing, pulse isn't too high. And the best time to perform this exercise is first thing in the morning before the patient has ate or anything like that. Alright, patient has call light, everything's good, so now I'm going to exit the room. Perform oral nasal suctioning. And I have gathered all my supplies. You'll need saline, a cup for your saline, sterile gloves, yonker, and then nasal suction tubing. I have all my supplies. My surface is clean and dry. I'm going to assess the patient for the need to suction. And prior to this, I had hand washing, introduced myself, identified the patient, identified that he had a PRN order for suctioning. Now I'm going to listen to the lungs, especially when you walk in the room, you can't already just hear the rattling and the moisture. Sometimes you can, but I want to listen to the lungs. I'm going to do it above the gown for this video. Mr. Smith, take a deep breath. Again. 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 Alright. Thank you. And I'm going to put the side roll down. Make sure that you put those back up before leaving the room. You want to make sure your patient's head is elevated if they're lying flatter, and you want it up pretty high. And you want to remember when suctioning to give breaks in between each suction and don't go more than 2 times into the nose, because you're also taking their mucus, but you're taking their air also. So you want to assess. If they don't have a pulse ox on, you can just watch for signs and symptoms of struggling breathing, their color, their respiratory effort. But I'm going to place pulse ox on and also assess for all of those signs. But this way I can actively see the reading as I'm doing this. You want to make sure all your supplies are within reach and how you want them. And I'm going to first go in the nose, and then I'm going to switch out equipment and go into the mouth. I want to check the date on your gloves. Make sure they're not out of date. Check for any holes, any kind of damage. Same thing on your normal saline. And these can be left up in the room. And if it's not a new bottle, it's already been used, check the date on it, and you're gonna wanna lip that bottle. Make sure the label is in your hand, take off the lid, and you're gonna pour it into a trash receptacle. When you pour, you wanna kinda spin like you were pouring honey or syrup. Place the lid back on. Lift the lid like this. I'm going to pour me some solution. Label is in my hand. Place the lid back on. Oh, you also want to assess your patient's chart and ask your patient if they have any allergies, specifically latex allergies. These gloves are latex free. Start this without turning my back on my field. And you want to examine this. There will be a top and a bottom, and you see where your cuffs are. You want to turn this around to where the cuffs are facing you, and make sure the height of your table is not too far below waist level, because anything below waist level, you have contaminated your field. Make sure you get these flat so it's easier to use. And you have a 1-inch border around your paper that you can sometimes use. A little difficult to fit and pull and straight. I can go 1 inch around, but I do not want to touch anything in the middle. And because all of that's sterile. And to put on my first glove, I'm going to put it on my dominant hand. I'm right-handed, so that's the hand I'm going to put on first. You grab it like this. Make sure not to touch anything below the folded cuff. Okay, it's on, and for this hand, I'm going to grab under the cuff, and you want to make sure your thumb is abducted where you look like a hitchhiker. Place this in so you don't accidentally touch this thumb with your non-sterile hand. Goes on. Now you don't want to touch anything below your wrist because that is not sterile. So if you need to adjust your fingers, you can now. And you want to keep your hands above your waist. Patient's good. And for this is obviously not sterile, but you would open a new package before opening your gloves and it would all be sterile. And right now, all of this is sterile, so I'm going to loop this around my dominant hand. And this part is going to attach to the suctioning on the wall that you had previously turned on, and you want it on 80 to 120 and continuous. So I'm going to attach that onto here. Now this hand is no longer going to be sterile. It's clean, but it's not sterile because I've now contaminated it. And you want to attach these two without touching your sterile hand. Now you can hold, and this is how you apply suction. You hold your finger on, it applies continuous suction. You let it off and on, it's intermittent. So I'm going to moisten check my suction with the saline, and you're going to hear the water sucking up in there if your suction is working properly. Alright, now we're going to go in one side, and remember when you are going in, you are not suctioning as going in, so make sure your thumb is off the suction. Keep it to the side. And you're going to go in, and as you come out, you're going to do the pill roll, and that helps you kind of get everything. And as you're going down, you'll go down until your patient starts to cough and pull out, and you don't want to go any longer than 10 seconds. So in, and I obviously cannot go as far in as what you would normally go. Go in, suction, suction, suction as you're pulling out. And then I'm going to clear my tubing. Assess how the patient's doing. Breathing okay, and it may take them a minute to, get their breath back, so give them the time, talk to them, reassure them, tell them to breathe, and then you can clear the other side. Roll. There you go. And to remove this, you would wrap it like this, and then you would wrap your glove around it, but I'm going to do the oral suctioning now, and I'm not going to change my gloves. So we're going to pretend like I took this off, threw it in the trash, and we're going to grab the yonker, and this one is not a sterile procedure. Make sure the patient's head of the bed is sitting up and patient's comfortable. Explain the procedure. Mr. Smith, I'm going to now suction in your mouth. I'm going to go side to side and in the back of your throat. You let me know at any time if you are uncomfortable. Patient opens mouth, go to one side, other side, and the back. Come out. Clear your tubing. Assess your patient. Make sure they're comfortable, they're breathing, they're not too anxious. And the whole time be monitoring your patient's pulse and oxygen status. Alright, Mr. Smith is doing good. He is breathing better now. I do not hear any more wet sounds or gurgling or crackles, so we did our job. And now I'm going to get the stuff ready for trach care. Alright, now we're going to move right into trach suctioning. I already applied sterile gloves in the last skill, so I'm not going to reapply them for this skill, but just know this is a sterile procedure and you will need to apply sterile gloves, your saline, your suctioning. You'll have your canister attached to the wall with suctioning and tubing. So I'm going to drape suctioning tubing on the patient's bedside. And we're going to pretend like this is a sterile package that I'm opening a new sterile suctioning device. But it's not, just know that it's not. This is your saline, same thing applies. Check the expiration. If it's not new, you need to lift the bottle. If it is brand new, then you need to date it and time it for when you opened it. So, and you would do this part, all of this, before you applied your sterile gloves. You would get your saline ready in your sterile cup. Open this package, have it ready, apply your sterile gloves. You are going to assess the need for suctioning. If the patient is on a vent, you're going to want to hyperventilate before doing this, because again, you are taking the patient's oxygen away along with the secretions. I'm going to put the bed rail down again for this, just so I can reach the patient and everything better. So if the patient is able to take some deep breaths on their own, have them do it about 3 times. That way they can get good and oxygenated before you do this. So, all right, Mr. Smith, I'm going to suction your trach now. All right, here we go. Sterile filled, remember 1 inch border around everything. You're gonna have 1 sterile hand, 1 clean hand. Your sterile hand, you're going to wrap it around. Everything's sterile. Once you touch this tubing down here, you are no longer sterile. Attach it. Tubing where you need it. You want to moisten this and check for suctioning. And you're going to hear the water go into the tubing if your suctioning is working properly. All right, Mr. Smith. I'm going to now suction your trach. You let me know if you are uncomfortable at any time and I will stop. For this, you are going to go in the trach. Do not apply suction while going in, only while going out. You go in, and you're not going to go in until you meet resistance, only the length of the trach. You don't want to enter the airway. You want to do the pill roll as you're coming out and intermittent suction. Clear your tubing. Assess your patient. Oxygen, good. And if they need it again, go ahead and do it again. But be sure and give them a break in between each suction. For the purpose of this video, I'm going to go ahead and do it again so you can see how you move the tubing and stuff for you. Going in, just about 3 inches or so. You don't want to go too deep. And then your thumb, this is your suction, intermittent. Twirl it around. Good. Clear your tubing, and this you will throw away. You're gonna in your glove, that way everything is still kept inside your glove. No issues. Okay, now we're gonna get ready for trach care. For trach care, it is a sterile procedure, so same thing applies. You'd want to have sterile gloves and always have 2 pairs of sterile gloves with you in case you break sterile field and you need to reapply them real quick. This is your trach care kit, and it will have 3 compartments, and you're going to use the first compartment filled with hydrogen peroxide and the next 2 with saline. And we're going to be cleaning the inner cannula of the trach. Some trachs have disposable ones where you can just take them out, throw them away, apply a new one. Other trachs do not. They come out and you can clean them. This is what we'll be cleaning. I'm gonna re-put that in, and it locks on so when the patient coughs it can't just fly out. Alright, I'm going to open this up. Discard this. I will take these off. So there's gloves in here. Take my gloves out. Move this. Remember, everything in there is sterile. Comes with a drape that we're going to put on the patient to keep the patient's chest dry and everything. And we're going to change this dressing underneath the trach. You want to assess the chart for any allergies such as latex. Remember your 1-inch border again. Dominant hand, I'm right-handed, so I'm going to apply these. Step back so you don't contaminate your field. Okay, on. Step back again. On. Alright. Now we're ready to start cleaning. I'm going to have 1 sterile hand, 1 dirty hand again. This is the dressing, or the drape, I should say. And there's a shiny side and a dull side. You want the shiny side down because that provides the moisture resistant to keep your patient's clothes clean and dry. Your kit comes with some cotton swabs, some pipe cleaners, and new trach ties. Take these out, drop, drop. This is to scrub the cannula with. These are for drying the cannula. These are for cleaning around the trach. And remember, 1 slot's going to have peroxide, 1 slot is going to have, 2 slots are going to have normal saline. I have put the peroxide and the normal saline in, and I'm going to take this out. I'm going to drop it in the peroxide. And you can use this. You're going to let it soak in there, make sure you get down in there, scrub, 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 get all the secretions. And then I'm going to throw this away. And there's a trash can down there. Now I'm going to drop this into the saline for rinse, and you want to make sure that you rinse it a few times. Grab your gauze for drying. Woo. Dry. You're going to use these pipe cleaners to dry inside there. Generally 2 will fit, and you just pull them all the way through. Do that a couple of times so you can get good and dry. Dry the outside again. These Q-tips will go in their 3rd fill of saline, and they're for cleaning around this. Cleaning the skin. This would not be here. Clean, dispose, clean, clean, dispose, clean, clean, dispose. And you just want to make sure this is all good and clean and free of junk. If you notice before you even get started, your patient has a lot of secretions outside and you're going to need more Q-tips than what the kit provides, you can add another package of sterile cotton swabs. So now we're going to place this back in, drop it in, and some of these will turn to lock in place. They'll have a dot down here and a dot on the cannula, and you want to line up those dots. This one does not. It has these wings, and you pinch them and then release once you push it down. So this is your dressing for your trach. Now we're going to try to keep that middle part as sterile as possible, and it's going to open up to keep this bottom part as dry. And this part is not sterile because you just can't do it without touching the patient and touching all of this. But if you want to try to keep that part that's going to touch the stoma and around the trach as sterile as you possibly can. And to change out trach ties, we're not going to because these are tied on there pretty good. But if you don't have 2 people to help, you always want to secure the new one before you remove the old one. So you would loop it through and let the patient know you're going to go behind the neck. And then loop it through again. Get it tight. Only 2 fingers should comfortably fit between the tie and your patient. If more than that, it needs to be tighter. Once these are secure, you can remove the old one, because if you remove the old tie while you're preparing this one and you're by yourself, the patient can cough and that thing goes flying out, and then we have a problem. So alright, that concludes my video for trach care. Thank you.